For the inversion process, we go ahead and get a plastic instrument and we try to push those pieces of the rubber dam inside to invert them inside, and this way we will cover the sulcus area. This is a good inverted rubber dam, and these are not inverted yet. So what do? We go ahead and we push with the plastic instrument. We can also blow air if we need to in order to push it inside. I found the plastic instrument to be the easiest method to do it. Some people also use dental floss in order to help them with the process, but I found the plastic instrument to be easy and helpful in the process. We go ahead and invert the premolar. Let's look at the labial surface also to make sure if it's inverted. As you can see, it's not. This will cause seepage of the saliva. It will interfere with your isolation. So you go ahead, you push the rubber dam, make sure it's inverted properly without tearing. And that is one of the reasons why we're using a plastic instrument, because it has a dull ending. It will not cause tearing of the rubber dam. Keep inverting. Inversion is an important part of the rubber dam placement. You have to make sure that your rubber dam is inverted properly in order for it to serve its purpose. Okay, so all of them are flossed in place. Rubber dam is inverted properly. We still have the canine needs to be also inverted well. One part of the rubber dam needs to be completed is that we need to get the piece of the dental floss out. We can just pull the rubber dam, get the piece of the dental floss that is tied to the retainer outside, because this will help us pull the clamp in case of emergency. In case the clamp moves or falls or breaks, this needs to be out to make it easier for you to pull it outside of the patient's mouth. Make sure I didn't affect my inversion. Okay. Remember, before we go ahead and place a rubber dam frame, that your clamp, the jaws are exposed, the bow is exposed, the dental floss is out in place, the rubber dam is in all the teeth, no holes are missed, and the rubber dam is inverted, and we have a stabilization distal to our last tooth. Always remember that when you isolate, you have to cross the midline. Either stop, if your clamp is on the molar, you can either stop at the canine or the premolar. And this is how we have placed the rubber dam.